Hi, my name is Holly Jacobson. I'm in the marketing department here at the Hospitals of Providence. Today I am joined by Dr. Anh Lee, and we are going to be discussing breast cancer and reconstruction options after breast cancer. So Dr. Lee, if you don't mind, if you could just start off by telling our viewers what your specialty is here at the Hospitals of Providence.
So I'm a plastic and reconstructive surgeon.
So I do want to encourage you all to chime in with your own questions in the comments below. If there's anything that you would like to know, we will try to answer it our best for you. So first off, if someone is diagnosed with breast cancer, when should they see a plastic surgeon?
They can see a plastic surgeon as soon as they're diagnosed. It's very important to have a plastic surgeon as part of your breast cancer journey.
So there are various types of breast reconstruction. So can you tell us about those?
So it's not a one-size-fit-all. That's why you have to see a plastic surgeon who can offer you all your options. The most common type of breast reconstruction is, of course, implant-based, but that is not for everybody, especially those who have undergone radiation, because 1 out of 3 women will fail their implants. So there's tissue reconstruction where you can use the skin and fat from your abdomen. So it's the same tissue that would be discarded during a tummy tuck, but we use it to recreate the breast.
So is it possible to have a breast reconstruction surgery at the same time as your mastectomy?
Definitely, and that's the best way to go if you can have immediate reconstruction. It just gives a better aesthetic cosmetic result.
So if you don't get it while you have your mastectomy, what's the timeline for when you should get it?
That's all going to depend on your treatment. So the oncologist will guide the patient if they have to have chemotherapy. So when they're done with chemotherapy, it's about 3 to 4 weeks after they're done when they can have reconstruction. And with radiation, I like to do it 3 to 6 months after they're done with radiation.
So after the surgery, what can, scar-wise and aesthetically, what can someone expect to see?
So if they are going to have an immediate reconstruction, the scars can be designed where it's going to look like a breast lift or hidden in the breast fold. If they have a delayed reconstruction, meaning they had their mastectomies first, that's why it's important to see a plastic surgeon so that we can design the mastectomy scars, which still can look like a breast lift instead of 2 long scars across the chest, which is outdated.
Mm-hmm. So you mentioned the hidden underneath. So is that the hidden scar technology? Can you tell us a little bit more about that?
So there's a lot of that going around. It's just how a breast surgeon can do a lumpectomy, a partial removal of the breast through the inframammary fold, which is the area underneath the breast, or around the areola.
So what's the difference between a Tram flap and a Diep flap?
So a Tram flap uses the muscle. So basically they are taking the muscle, skin, fat, and rotating it up. The Diep surgery is a microsurgical operation where it's an actual transplant of just the skin and fat, so the muscle is left intact. And then it is brought up and connected to vessels here in the chest to create the breast.
So is between the Tram flap and the Diep flap, is there one that is, preferred typically, or does it just depend on the person's diagnosis and mastectomy surgery?
So if anybody is a candidate for a Tram flap, they're automatically a candidate for the Diep flap. And so the issue is not a lot of plastic surgeons do the Diep flap because it's a tedious procedure and you have to love to do it to do this procedure.
Okay. So whenever someone decides that they're going to get breast reconstruction, is it their decision what they want, or are they kind of guided by their surgeon?
They should be given all their options by their doctors, which unfortunately doesn't happen, but in the end it's the patient's decision whether or not they're going to have reconstruction, because some patients decide they just want to have their mastectomies and be done, mm-hmm. which is their choice, and other patients, they want to have their options told to them.
So after someone receives a mastectomy and they do decide to go forward with reconstruction, is their insurance legally obligated to cover that expense?
It's the law. The insurance companies will cover the surgeries until the patient is satisfied with their results.
So you did mention at the very beginning that it's your recommendation that as soon as they're diagnosed that they contact a surgeon. Is there any other messages that you would have for someone who just found out that they had breast cancer and going to be receiving a mastectomy?
To definitely research and know what all your options are before you take that leap. It's very important to know that beforehand.
So if we have a viewer watching who is aware that they're going to be receiving a mastectomy and they are looking for a plastic surgeon, how would they get in contact with you? What's the best way to get in contact with you?
So I 351-9000 is my office number, and I also have a website and my Facebook pages, and there's pages dedicated to breast reconstruction on there.
Great. Well, I also encourage you to visit thehospitalsofprovidence.com and look into our breast care and also our cancer care services that we have here. And once again, if you would like to contact Dr. Lee's office, then the number is 359-1000.
351-9000.
Oh, 351-9000. Okay, I almost had it. All right. Well, thank you so much for viewing, and have a good rest of your day.